Hi and welcome to a lecture on systemic lupus erythematosus. Systemic lupus erythematosus, also referred to as SLE or lupus, is a chronic long-term autoimmune disease that causes systemic inflammation which affects multiple organs. Lupus affects about 1 in 1,000 to 2,000 individuals, predominantly young women in their reproductive years. In addition to affecting the skin and joints, lupus can also affect other organs in the body such as the kidneys, the tissue lining the lungs, heart and the brain. Pharmacologic choices. To reduce the risk of osteoporosis, it is important to encourage adequate calcium intake and a vitamin D supplement. Rashes may be treated locally either with topical corticosteroids or the calcineurin inhibitors such as tacrolimus or pimecrolimus. Note here that more refractory skin disease may require systemic therapy, most often with antimalarial drugs. Systemic therapies. Aspirin and other non-steroidal anti-inflammatory drugs are often used to treat joint pain as well as pleuritic chest pain in patients with pleuritis or pericarditis. It is important to note here that high doses of non-steroidal anti-inflammatory drugs have been associated with the development of aseptic meningitis in some patients with systemic lupus erythematosus. In general, all non-steroidal anti-inflammatory drugs demonstrate an increased risk of cardiovascular events. Antimalarials. Hydroxychloroquine or chloroquine are considered baseline therapy for a majority of patients with systemic lupus erythematosus. These agents are particularly useful for the most common disease manifestations, which include photosensitive rashes, arthritis and fatigue. Here again, these agents are often used in combination with other agents, including corticosteroids and immunosuppressants. Corticosteroid-sparing agents. To reduce corticosteroid-associated adverse effects, corticosteroids are almost always combined with corticosteroid-sparing agents. Examples of corticosteroid-sparing agents include the immunosuppressants, immunomodulators, or biologic agents. Cyclophosphamide is generally used as induction therapy and is combined with corticosteroids for the treatment of severe lupus involving the kidneys or nervous system or in patients with vasculitis. It is usually given intravenous monthly for 6 doses or a low dose is given every 2 weeks for 3 months. Mycophenolate mofetil is equivalent to cyclophosphamide for induction therapy in proliferative lupus nephritis.